In this video, we are going to cover mixing and loading alginate impression trays. There are two types of alginate, regular set and fast set. With regular set, you have a working time of about 2 minutes, which includes mixing and loading the tray, and then it takes about 4.5 minutes for that to set. With fast set, you have about 1.25 minutes of mixing time, but only 1 or 2 minutes of setting time. Generally, this is much more comfortable for the patient because it does not have to stay in their mouth as long. So for this demonstration, we will be using fast set. The first step is to fluff the powder. We do this by tilting and rolling the can, and making sure that it's not clumped. And this creates a more accurate measurement of your alginate. Carefully remove the lid. Then we use a scoop. This comes with the alginate and it's pre-measured. It is 1 scoop of powder to 1 measure of water. And this is pre-measured as well. There are markings on the vial. Take a heaping scoop of alginate. Then take the back flat edge of your spatula and gently tap the alginate down into the scoop until you can no longer see any voids. Then scrape any excess off. For infection control purposes, we put this into a plastic cup. Then we cover the alginate and set it to the side. Next, we put the water into our flexible bowl. And you can see the markings on the vial. We are using 1 measure of water to 1 scoop of powder. Pour the water into the bowl, then pour in the alginate. The next step is to mix the alginate. You start by gently stirring the alginate so that all of the powder is wet. Once the powder is wet, using the flat side of your spatula, begin to stir and smash the alginate onto the side of the bowl. This is also called stropping. This gets rid of any bubbles and makes a nice smooth mix. Remember, we only have about 1.25 minutes to get this into the tray and into the patient's mouth. When it's nice and smooth, scoop it up on your spatula and wipe it into your tray. Gently press down so that there are no voids. Then dip your finger in some water and smooth the top of the alginate. This also helps to create a nice, smooth impression. The impression is now ready to go into the patient's mouth.